We've been talking about healthcare a lot on this show because it is in a near crisis mode, and rural healthcare, that is in a crisis. And that's what's making it shocking to a lot of people that Mayo Clinic plans to close 6 clinics by mid-December, removing a lot of options from communities in the rural part of our state, forcing patients to travel further for basic medical care. Mayo is saying its decision strengthens rural health care, but the southern Minnesota community is in disagreement to that, alleging Mayo is putting profits before people. Here's Jessica Hart.
Montgomery, a town of 3,200, is about to lose its last clinic.
Having a clinic in town is very important to us.
Rita Hoffman has lived here for 71 years.
That's the last thing I want to see closed.
In southern Minnesota, her clinic is one of 6. Mayo Clinic Health System is closing.
Access to health care should not be limited just by your geography or your zip code.
Outside Mayo Clinic St. Mary's campus, unions representing impacted workers were anything but silent.
When these facilities close their doors, they close to everyone in the community. And travel times become a barrier to health care, even for those with insurance.
December 10th is the last day the health system's Montgomery, Belle Plaine, Wells, Caledonia, North Mankato, and St. Peter locations will see patients.
Health care in greater Minnesota is a very difficult thing to keep going. It impacts people's lives. It impacts the lives of entire communities. It makes it more difficult for many people to receive services, so we are really disappointed.
Todd Profke is St. Peter's city administrator, a town of more than 12,000.
We are going to be better off than most.
Better off because they have other clinics and a city-run hospital.
I think there's a lot of unknowns still that we as a community don't know what's happening yet. So, it's just take it day by day and do the best to reassure our community that they're going to be taken care of.
Stephanie Holden works at Rivers Edge Hospital, where many of the hospital's patients are Mayo patients.
I never would have thought that St. Peter would have lost the clinic location under the Mayo system. I think that is why we were so surprised.
A surprise no one wanted.
I mean, it's heartbreaking.
Heartbreaking news impacting thousands of lives.
It's just a symbol to our town. I mean, you hate to see something like this close. For all my life, I'm 71 and I've seen a clinic in this town my whole life.
In Montgomery, Jessica Hart, KARE 11 News.
So what does Mayo have to say? In a statement, they told us rural and community health care across the country is facing significant challenges, including staffing shortages and declining patient volumes. MCHS is committed to continuing to provide high-quality rural health care, and to do that, we must adapt.